Hi, Brandon. How are you?
Good. How about you?
Good. So my name's Abby. I'm gonna be your nurse today. So today I'm gonna do an abdominal exam. Have you ever had an abdominal exam before?
Not that I know of.
No? Okay. So I'm just gonna ask you a few questions. Do you have any problems with your stomach at the moment?
No.
Any problems in the past?
No.
Any family history of inflammatory bowel disease?
Not that I know of.
Anything else family history wise?
Not that I know of.
No? Okay. Do you have any problems with nausea, vomiting?
No.
Any appetite problems?
No.
Any problems using the bathroom?
No.
No? Okay, great. So it sounds like you don't have any problems with your stomach, right?
Yeah.
Okay, great. So I'm just gonna start the exam by having you lay down, okay? Are you gonna be comfortable with that? And I'm just gonna have to lift your shirt and I'm gonna look at your stomach. I'm gonna auscultate your stomach with my stethoscope. Then I'm going to percuss your stomach and feel your stomach, okay?
Mm-hmm.
All right. So can you lay down for me? All right, so I'm just gonna raise your shirt a little bit. And first I'm gonna look at your stomach. So I'm looking for any striae, which I don't see any. I'm looking at symmetry. I'm looking at movement of his stomach, which would be obviously him breathing, or peristalsis, which is going on in there. I'm looking for any scars, which I don't see any. I'm looking for any bulges or anything like that, which could, I don't see anything like that, which could indicate hernias, which I don't see anything. And I'm also looking for any veins or anything like that. So you look great. And now I'm gonna listen to your stomach, okay, in all 4 quadrants. I'm gonna start in the right lower quadrant. And then I go up to the right upper quadrant. Then I go to the left upper quadrant. Then I go to the left lower quadrant. And I'm just listening to your bowel sounds, making sure that nothing's hyperactive or hypoactive, which you sound perfect. Now I'm gonna listen to your stomach as well and listen for bruits. So I'm gonna listen to your aorta, and I'm gonna listen first with the diaphragm of my stethoscope. Then I listen to the renal artery on both sides. Then I'm listening to the iliac on both sides. And then I listen to femoral on both sides. Making sure I don't hear any abnormal sounds. And then I switch to the diaphragm of my stethoscope and listen again at the aorta. In the renal. And the iliac. And the iliac. And the femoral. And the femoral. Everything sounds great. I don't hear anything abnormal. Okay, now I'm going to percuss. I would do this in all 4 quadrants. Making sure I hear timpani, nothing dull. Perfect. Timpani throughout all 4 quadrants. And now I'm gonna lightly palpate in all 4 quadrants. Starting in the right lower quadrant. Just light palpation with the tips of my fingers. I can lightly feel the outline of the organs. Not feeling anything abnormal. And then I'm going to do 2 tests to see if you have cholecystitis or appendicitis. So I'm going to do the Murphy sign, which I'm going to feel for your gallbladder, and once I feel it in the midclavicular line, I feel it here, and this is the Murphy sign. And I ask you to take a deep breath. And when I push in, if he was not able to take the full deep breath and it was interrupted, that could indicate cholecystitis. But he was able to take the full breath, so he does not have it. So now I'm going to do the so sign, and by doing this, on the right side, I can lift up his leg. And do you feel any pain?
No.
No. Okay. And can you turn onto your left side? There's 2 ways of doing this test. And when I'm gonna hold right here and pull your leg back. Let me pull your leg back like this. Do you feel any pain?
No.
Okay. And if he felt pain, it could indicate appendicitis, which he doesn't, so there's no indication of it. And you can sit up again. And that ends my abdominal exam. Thank you.
Well.